Good morning, everybody. Today is June 28th, and I'm welcoming you to the Curriculum Committee meeting. We have all members present, and I need a motion to approve the agenda.
So moved.
Second.
All in favor?
Aye.
Aye. 4-0. Approval of the May 24th meeting minutes.
So moved. Oh,
Second.
All in favor?
aye.
Aye.
4-0. Thank you. Going to hand it over to Dr. Rogers.
Good morning, board members. Thank you for being here today. We have many items on our agenda. I would first like to welcome Dr. Houlihan, who will start us off with our discussion item.
Hey, so good morning, everyone. So over the past couple of years, we have noticed a shift in what has historically been our English language learner demographics. The feds and the state have now shifted that language to be called multilingual learners, not English language learners. So I asked our staff to put together an end of year update on where we're seeing demographic shifts, where our multilingual learners are positioned in which schools, and what we're doing about it. As you may remember, we are committing a little bit over, I believe, $1 million of ESSER funds for the past couple of years to help with strategies on supporting and working with our teachers who are serving our multilingual learners, as well as strategies around interventions and core instruction for improving academic performance for this student subgroup. So Dr. Elania Daniels, who is our director of federal programs and oversees this department, she is here and is going to give you a brief presentation. She has a couple of her staff with her as well if there are any detailed questions. But again, we thought that this is really interesting information for you all to take a look at and really focus in on what we're doing to support this subgroup of kids, which is really sharply increasing in this county. So Dr. Daniels, I will turn it over to you.
Good morning, and thank you for the opportunity to showcase our multilingual learners' progress and trends over the past 3 years. During the presentation, I will highlight a few data points and anticipated outcomes. Multilingual learners are defined by 3 categories that determines the appropriate level of services and supports. They include novice, intermediate, and transitional. Over the past 3 years, we have noticed an increase of multilingual learners who have been identified in the 3 service categories. In 2021, UCPS had a total of 2,521 students. From September of 2022 to May of 2023, we have expanded that number by 360 students. Overall, the number of multilingual learners has escalated by 1,107 students from 2020 to 2023. This speaks to the growing rate of ML students in Union County Public Schools. To highlight the number of students by cluster, on this slide, we have 4 clusters with the largest number of ML students in the 3 service categories. The Monroe cluster is leading with 997 students, followed by the Porter Ridge cluster with 704, Forest Hills at 645, and finally Sun Valley with 495. To focus on another trend, we looked at the top 10 schools in the district with the most ML students and compared them from last year's ML population to the current school year. Now, this comparison tells a different story. While the Monroe cluster historically had the most ML students, this graph depicts that Indian Trail Elementary has the most significant growing number of multilingual learners. Indian Trail Elementary has made a substantial increase by 72 students from last school year to this school year, followed by Rockrest Elementary with 72, Porter Ridge Middle School with 62, Porter Ridge Elementary and Monroe High School, both at 52 students. Currently, we are serving students in 63 languages that is represented in UCPS, with most of our ML students are speaking the language of Spanish. According to our home language surveys, the second most spoken language is Russian with 305 students, followed by Ukrainian at 83. So to summarize, the WIDA access scores illustrates the anticipated impact on the need to continually support teachers and administrators around the growing number of multilingual learners. Notice in the yellow shaded area, this includes the number of students who will receive novice services in 2021 and 2022. And compare that to this school year, there is a significant increase. In this particular bell curve, notice the spike in blue. This provides a visual of the number of students who will need direct services as their WIDA access scores fell between the range of 1.0 to 2.2. So as a result, we are preparing for this growing population as we equip administrators as well as teachers with resources. So our next steps are to continue to analyze and share the WIDA access information with principals and ESL staff early. This will give them an opportunity to provide them with the awareness of their school's growth and to provide support with planning for the upcoming school year. It is also important to prepare teachers for this increase, as it is important to ensure that teachers are equipped to be able to participate in intentional professional development, not just necessarily for ESL teachers, but for various staff members. And this is based on a tiered approach model. So for instance, if we have a school that has a significant number of students receiving direct services, such as novice or intermediate, the staff members will participate in professional development. Each principal will select staff members to develop an instructional team that will include a school-based champion who will provide PLC collaboration to equip teachers with resources and support as we build the capacity for quality instructional practices. By starting off with a school-based team who will meet regularly during their PLC meetings, this will strengthen the academic outcome for all students. Finally, due to the rising number of ML students who will require direct services, we will continue to staff the following positions. We will continue to have our ESL teachers, staff schools with our language facilitators, as well as our parent liaisons. We'll have 3 ESL counselors who will provide social and emotional supports, as well as college and career readiness. And we will also continue with our ESL tutors. This concludes my presentation. At this time, are there any questions?
Does anyone have any questions?
I do. What do the parent liaisons do?
Our parent liaisons work very closely with our families and students who provide services by way of meal deliveries. They also support with translation services, supports for IEP meetings, 504s, as well as Latino outreach. They've also supported with child nutrition endeavors, as well as school open house events.
Okay. So we're going to do these positions this year with ESSER funds?
That is the ongoing.
These were the positions we funded last year and would come before the board as part of the ESSER plan whenever Ms. McLean brings that to finance, whenever her next update is.
So this year is covered and then we have to do something the following year?
That's correct. Yeah, I mean, these are all positions that are funded, as well as we're using funds for professional development that when ESSER funds go away, this time next year, all of these positions and this work would be eliminated unless we have a different funding source.
Yeah. Okay, That was my question.
I guess on top of that question, so for instance, parent liaisons, we have some parent liaison positions not funded with ESSER though, right?
That's correct, especially in our
Okay.
Title I schools.
And is that the same for these other categories? Like, do we have some language facilitators that are not like more than just these three?
Dr. Daniels, I'd have to ask you to answer that one.
Absolutely. So our language facilitators were designed to kind of fill in the gap and support as a teacher assistant in some of our said schools. And so they work very closely with our ML students as well as our ESL staff. So for example, when we have schools such as Porter Ridge Middle and High School, who has also a growing number of ML students, our language facilitators sort of fill in the gap for that instructional support.
Do we have translators? Like a position that's a translator?
We do
Or-
have several translator positions that operate out of the ESL department.
Okay. Does anybody have any other questions?
So we've
I'm just
already
saying, what-
approved,
Oh,
we've already approved the ESSER funds for this year.
I don't know. I'd have to ask Ms. McLam. I know that she would bring an annual update of what the funding plan is for ESSER, but I'm not sure if that's gone to the board yet.
Okay, I'll talk to Mrs. McLam about it. Thank you.
And how long have we had this program? Like, is this only is this more recent and it's been funded through ESSER? I'm trying to, is that right?
Yes,
We've been doing it through ESSER funds. Yep.
So when ESSER runs out down the road, we need to look to approve for additional funding outside of ESSER.
Yes.
correct.
Okay, so we're waiting to find out if we're needing that, if it's funded this time. When does that run out? Do we know?
September of a year from this coming September
24.
is the deadline.
2024.
Correct.
So we have another year.
So we have another year with, okay. So is this we're trying to bring this to the board for additional ESSER funding for this year, and then next year we'll, okay. Make sure.
Correct.
I have a couple of questions, a few questions. I see one of dealing with the languages and the amount of students that we have. Are we in partnership with, I know there is a Latino coalition. I don't know how, what type of relationship we have with the school system, but with the other languages that we have in our community, are we in partnership with coalitions to help support all of the different representations of cultures that we have?
I will have to defer to Mr. Chahada, who would be able to answer that question.
Good morning. The Latino Coalition works. We work with the Latino Coalition, not necessarily to support language needs. There have been some contacts done with other community organizations to help with different needs.
Okay, and that's you answered the other part, not just with the language, but as far as just helping to support the whole family as they are part of Union County Public Schools, making sure that child and guardian and parent are supported. So, okay. I think Ms. Heintel asked my question about the parent liaison, so I'm good. No more questions on my end. Thank you.
thank you so much, Dr. Daniels, for that presentation. It's not an action item, it's just discussion. Okay.
Correct.
So next we have the UCPS Improvement Plan for School Mental Health 2023.
Yeah, so we're seeking approval for this school mental health plan. The plan is required by state board policy and is supported by Senate Bill 476. So as you saw in the memo, updates to the plan are highlighted in yellow, and then all the other information remains the same as 2022. And we have Mr. McGraw and Ms. Kasha Giddens here to answer any questions that you may have.
Does anyone have any questions?
No.
Yes, ma'am. How has the
Wait.
telehealth,
No, I
Can you
don't have any questions. No.
Okay. Reverend Kirkpatrick? Did you have a question?
yes, ma'am. How has the, yes, ma'am. The telehealth, Atrium Telehealth, how has that been going with our students? How has that program been going?
Reverend Kirkpatrick, the teletherapy, the partnership with Atrium Health has gone very well. We have that we offer that in all 11 high schools. But we initially started in a selected few high schools, and now it is in all 11 high schools, and it's going very well. Ms. Giddens and the Atrium team meet often to review those numbers, and so far things are going well.
So we can agree that it has really been a great support to our students.
Definitely, yes, sir. You know, parents have to okay for their students to see the therapist, and they have to give approval. And but overall, it's been a great addition to the services we already provide within Union County Schools.
Awesome. Yes.
I think when we decided to add it, it was because we had a wait list. How has that been? Are we being able to service everyone using this, or do we still have a little bit of a list?
I think we always have people that have to wait to get the service, Ms. May, but this has given us another option. You know, our in-person mental health therapists were maxed out, both with the people who work for UCPS and our collaborative partners. The teletherapy give us the ability to see more students and help with the waiting list caseload. But we see those people as quickly as possible. And once the parents give us permission, you know, that we're able to see them.
Okay. Does anyone else have questions?
And so that was my question. I wanted to make sure. So the students we are making sure that students are getting, regardless of their age or whatever, are getting approval or consent from parents before any of that is any treatment or mental health, anything is being done, correct?
That is correct, Ms. Green. We cannot refer people to teletherapy or regular therapists unless parents give consent. Parents have to give consent.
Absolutely. Okay, thank you.
Even if they're 18?
Yes, if they're students, parents have to give consent, Reverend Kirkpatrick.
Because aren't they still they're still enrolled, so they would, right?
Yes, ma'am, that is correct.
Okay.
If there aren't any more questions, I need a motion to approve sending this to the full board.
So move.
Second.
All in
All
favor?
in favor? Sorry.
Aye.
4-0. Sole source purchase Follett Content Solutions.
Yes, ma'am. So we are seeking approval for a sole source contract for Follett Content Solutions to use them as a vendor to support our International Baccalaureate program and utilize their materials as noted in the memo. We do have Ms. Jessica Garner here to answer any questions that you may have.
Does anyone have any questions?
No, I move to approve this.
Second.
All in favor?
Aye.
4-0. Thank you. Tobacco prevention curriculum.
Yes, ma'am. So you received the memo regarding this curriculum as well, and Ms. Garner is here to answer any questions that you may have.
Any questions?
I have a question. Is Is there an opt-out if the parents don't want to do it? Their kids, like we have sex ed, where you can opt out of it?
No, ma'am, we do not have that provided by either state law or in-board policy for tobacco.
Okay. What about drugs?
No,
No.
there's no opt-out for these. These are part of the North Carolina Healthful Living Standards. And the only clause that's included as an opt-out is for anything that's related to the sex ed curriculum.
So this comes down from the state. Yes.
This curriculum is not from the state. The standards are from the state, and this is a curriculum resource we would like to have approved for our teachers to be able to help our students understand the dangers of vaping and strategies to resist.
That's
Any
all I
other
have.
questions?
We have you all been able to identify the issue with vaping in our county?
We're losing you, John.
Yeah, I think you're frozen.
Oh, you're back. Okay.
Am I back? I'm in a cubby hole, so I'm sorry.
Except your hand's
Can you
frozen.
hear me now?
Yes.
What?
What's the question?
What about now?
We can hear you now.
Yes. Can you ask the question again?
Okay, maybe
No.
I can't.
No, you're
Um,
cutting in and out.
What? Don't.
You're coming
It's
in and
not that
out.
important. It's fine.
You don't,
Okay.
okay. You're good?
You're good?
I'm good.
Any other
Is that free?
questions?
Is that good?
Okay, good.
Motion to approve? Oh my God.
Okay. I move to take this to the full board.
Second.
All in
Second.
favor?
Aye.
We have a
4-0.
big problem in Union County Public Schools with vaping, so
Yes.
something.
Well, every other kid is doing, and they make
Crazy.
them in like flavors and different things, so the kids
Right.
find it more attractive and.
Yeah.
And you're not cool if you don't have one or holding one of those. I think it's
Yeah.
awful.
Stepping Stones
Crazy.
group contract?
Yes, we're seeking approval for this contract for behavior intervention services, as noted in the memo. And then we have Dr. Beecham here to answer questions.
I have a question. This says that we'll be using ESSER funds from July to September of 23, and then we're going to use Medicaid. What did we use Medicaid before this? Like, are we taking away something to do this, or?
Our Medicaid funds are typically used for our psychological services. So when we applied for our grant for our ESSER funds, we did include behavior intervention services and psychological services part of our grant for the ESSER. The EC ESSER funding runs a little differently than the Reg Ed. Ours expires in December, so we have to fully expend those by September. So that is why we ended in September, and then we'll pick up and finish out the year with our Medicaid, which we would traditionally use that fund for services
Okay.
such as this.
Okay. That was my only question.
So then to follow that, did we have Medicaid that we didn't use? And so then we could use that for something else, or that's not how it works?
So our Medicaid carries over each year. So we have used our Medicaid funds to continue bringing in services to backfill the lack of school psychologists and contracting our outside school psychologists.
Okay. Any other questions? Need a motion to send this to the full board?
So moved.
Second.
All in favor?
Aye.
4-0. Center for Educational and Psychological Evaluations contract.
Yes, ma'am. This is the last contract for approval today, and you have received the memo with the information, and Dr. Beecham is here for any questions.
Okay, I'm gonna go back again. And with the same as this as Medicaid and ESSER funds. Can you go back and you can email us, what's the amount that's coming out of ESSER and what's the other ones coming out of Medicaid? Just so we know. Is most of it from ESSER? Is most of it from Medicaid? It says it should not exceed $120,000 using ESSER funds and Medicaid. Is it the same amount every month or what is it?
With the psychological services, that varies based on evaluations.
Okay,
So the entire contract would not exceed that per year. But from the amount, from the time from July to September, the amount would vary based on how many evaluations we do.
gotcha,
But for the entire year, it would not exceed that cap.
gotcha. Okay, okay. But it was this kind of the same thing with the stepping stones thing. Is that monthly or is it,
So the
is the
stepping
same
stone,
thing?
yes, ma'am. The stepping stones is a little more concrete because we are billed based on a salary. So we get a monthly invoice based on a salary for 2 individuals.
Gotcha. Okay, thank you.
You're welcome.
Any other
I move-
questions?
I move to send this to the full board.
Second.
All in favor?
Okay.
4-0. Digital resource renewal for 23-24 Follett.
This is our final action item for today for digital resource renewal for Follett. And this is to be able to continue our library management and resource management, the inventory process that we have. I'll open it up to questions you have.
My question is, because it's digital library, is 5-1, are we gonna look at that?
So I see that Casey Rimmer has just joined us. I'll have her answer that question for us.
So we actually do use Follett quite often to inventory our library collections. And so that is one of our strategies that if it's been approved to be added to the library, that's one of the safeguards that we have in place that all teachers can look inside of the Destiny collection to make sure that it's been approved by their media advisory committee. So this is just a safeguard to help support 5-1.
Any other questions?
Then Kathy, at all?
So are they required to go in to look at it for 5-1 or I still want to understand?
So what we have shared with principals is that because they have approved their media library collections, and that's the list of books that are in Destiny,
Okay.
teachers are not inventorying their collections in their classroom through Destiny, but they use their library collection to check to make sure a book has been approved. If it's not been approved, then the policy states that it has to go
I
through
got
the
it now.
media advisory
Okay.
committee. Yeah,
I
thank
got
you.
it now. Okay.
Any other questions? Need a motion to send this to the full board?
So moved.
Second.
All in favor?
Aye.
4-0. Our next meeting date is August 23rd at 10 a.m. via Zoom. Need a motion to adjourn.
So moved.
Second.
All in favor?
Aye.
4-0. Thanks,
Thank you all.
everybody.
Have a good
Appreciate
day.
it.
Thank you.
Have a good one.
Thanks.